Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at DamiRx Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. All right there, so what is our medication of choice today? So our medication of choice today is known as vitamin B. So vitamin B comes in different forms. So there's vitamin B-1, there's vitamin B-6, there's vitamin B-9, vitamin B-12. So it comes in different types, which I'm going to link a visual in this video. That way you can see the different type of vitamin B that exists and how they all come in different supplements. Usually patients will take a vitamin B complex, which usually contains most of the vitamin B components to it. So definitely you want to check that out if you just need a regular vitamin B supplement. So I would definitely go with the vitamin B complex, except if the doctor specifically says they want you to be on vitamin B-1 instead of vitamin B complex. Then you definitely want to differentiate between taking those. All right, so let's dive right into the different type of vitamin B that I am going to talk about for the sake of this video. All right, so for vitamin B1, so vitamin B1 is known as thiamine. So vitamin B1 can be used in patients who have alcohol withdrawal. It can be used in patients who have a condition called beriberi, and also patients who have severe vomiting. In pregnant patients, they can also use this as well to prevent that severe vomiting. Also, there's a syndrome called Wernicke-Korsakoff syndrome where vitamin B1 can definitely also be helpful. All right, so what is the next one? So the next one is vitamin B6. So vitamin B6 is also known as pyridoxine. So vitamin B6 is used in patients who are treating neuropathy, which would be like a nerve condition, more of like a nerve pain, tingling. Also patients who are treating a pyridoxine dependent epilepsy. So patients who are treating kind of like a seizure related to low pyridoxine level, patients can benefit from vitamin B6 as well as isoniazid poisoning. So patients who are taking TB medication, so isoniazid is usually taken in patients who have tuberculosis. It's taken with like rifampin and some other medications in order to help suppress the tuberculosis. So if the patients end up taking too much of the isoniazid component, then the vitamin B6 can come in place and kind of help reduce that poisoning in those patients. Also, we're going to talk about vitamin B7. So what is vitamin B7? So vitamin B7 is biotin. So biotin can be used in patients who have vaginal candidiasis, which in layman term means vaginal fungal infection. So also patients who have brittle nails as well as alopecia can benefit from biotin as well. So biotin is primarily one of the medications that's used in like your hair, skin, and nails supplements to kind of help grow like your hair, your skin, or your nails. Also, for the next one, we're going to talk about vitamin B9. So vitamin B9 is known as folic acid. Folic acid is also a major component in your hair, skin, and nails supplement, as well as this can also help in terms of growth. Folic acid is also used in patients who have anemia, as well as, which brings me to the last medication, which is vitamin B12. So vitamin B12 can also be used in patients who have a folic acid deficiency or patients who have anemia as well. So both the folic acid and B12 sometimes is prescribed together because these are known as macrocytic anemia, which are anemia that has to do with those low levels of your folic acid as well as your B12. All right, so how is this medication taken? So usually it's taken as a 1 tablet daily, and patients will usually take that with a cup of water daily. And so usually this medication is taken as a 1 tablet by mouth a day. All right, so what are some side effects to know about vitamin B complex? So we're talking about vitamin B complex as a whole, so the one that contains almost all the B vitamins. All right, so a common side effect of vitamin B complex will be upset stomach. So patient might notice some upset stomach, you might notice vomiting, as well as some patients may have constipation, which would be like hard stools, or a patient will have like loose stools, which would be like another form of diarrhea. Also, patient can also have like a form of altered taste depending on the component of the tablet, as well as loss of appetite and nausea while taking this medication. All right, so a very definite side effect that you want to report to your doctor would be that consistent hard stool or loose stool. So if you definitely are not able to get your food down well, like you're having loose stools each time you take this medication, then you definitely want to bring that up to your doctor. Or if you're having issues going to the bathroom, then you definitely want to bring that up to the doctor as well. All right, so how do you take this medication? How does it work? How can you take this medication effectively? So this medication you definitely want to use as directed by your doctor. Also, if you're getting the vitamin B over the counter, it would usually come with like the label, which is most likely 1 tablet a day. Also, like I said, this medication can cause upset stomach, or patients start throwing up while they're on this medication. A way to go around that is by taking small meals. Also, you want to incorporate some good oral care or hygiene in there. If that's not helping, then you want to probably get like a hard candy, like a hard sugar-free candy, or you want to chew on like the sugar-free gum to kind of help with that upset stomach, or the vomiting feeling. So that usually helps with that. Also, if you start noticing any hard stool in form of constipation, then you want to make sure that you're drinking enough liquid. Also, making sure that you're incorporating some fiber into your diet, as well as also working out. Exercise can definitely help in terms of constipation or hard stool. You definitely want to reach out to your doctor before you take any stool softener or laxative while you're on this medication. Also, in terms of taking this medication, it can be taken with or without food. You can take it with food if you start noticing some form of upset stomach. That can kind of help suppress it. So you can take it with a small meal, as I said earlier, to kind of help with that upset stomach that you're feeling. Also, in terms of long-acting products, so they have some vitamin B that are longer acting. So in terms of those tablets, you definitely don't want to chew, break, or crush those. So you want to swallow the whole tablet with a full cup of water. This medication also comes in a medication called Gevrabon liquid, so that can be used as well if you're not able to take tablet or capsule. One thing about that is you want to make sure that you shake it very well before use. That way, the solution is completely, you're getting a mixture of all the vitamins that are in that solution. Also, for patients who are using a feeding tube, they can also use this liquid as well if they're not able to swallow. But one thing you want to use in terms of patients using this with the feeding tube is you want to flush the feeding tube before and after inserting this medication. All right, I hope I was able to help in terms of what to look out for while you're taking this medication. If you have any questions or concerns, you can feel free to reach out to us or one of our medication experts at www.demyrxcare.com. All right, thank you and stay